Hello again, it's Colorectal Cancer Awareness Month, and experts are advising that you must listen to your gut. Well, they are concerned that millions of adults tend to avoid colorectal cancer screening. It's believed that the disease affects 1 in 77 men and 1 in 132 women in South Africa every year. How do we know the signs to look out for and what can be done? Well, I'm joined now by Dr. Smitha Abraham, who's a radiation oncologist. Doc, good afternoon. Welcome. I mean, colorectal cancer is not a subject that people ordinarily discuss. However, it's an important one because, it can kill you. Like most cancers, it can be treated, it can be avoided. I mean, how widespread is it in South Africa today?
Hi, Dan. Thank you. So with regards to colon cancer in South Africa, it's the second most common diagnosed cancer in men and the third most common cancer diagnosed in South African women. So it is relatively common. And awareness programs such as these is important to educate the public on the signs and symptoms, what tests to do to pick up the cancer early. And I think it's also important to try and remove the fear and stigma related around cancer.
Yeah, what are the risk factors?
So the risk factors is generally if you have a family history, that usually accounts for 5 to 10% of colorectal cancer. If you have a previous history of inflammatory bowel disease, or if you've got polyps, these are small little growths that occur on the lining of the intestine that can be a precursor to develop colon cancer. And of course, then there's other lifestyle factors such as obesity, your diet, a poor diet in low fiber or high fat, highly processed meat, and excessive alcohol and smoking can predispose you to developing colon cancer.
Yeah, and symptoms, what should you look out for?
So symptoms can vary. So in the advanced stages, you can present with changes in bowel habits. So varying from constipation to then bouts of diarrhea. You may also present with abdominal pain, a feeling that your bowel doesn't empty properly. So you feel like you're not going to emptying the bowel properly. That's a symptom called as tenesmus. And in the advanced setting, you can also present with bleeding. So if you have bleeding when you pass stools, that can commonly occur when the tumors on the left-hand side of the colon, but tumors developing on the right-hand side of the colon, you might not present with bleeding, but you might present with feeling of fatigue and anemia, which is a sign that you're losing blood. And weight loss can also be a symptom in the advanced setting. But what is important is you must actually do a test before these symptoms occur.
Yeah, now the testing, I mean, as you were talking there, you mentioned the word polyp. About 5 years ago or so, I did a colonoscopy with my gastroenterologist just to check. And he said he was looking for polyps.
Very
and I
good.
said, what are polyps? What are these things? I didn't know that we can have polyps in our... Fortunately for me, nothing was found. But is colonoscopy one of the ways of screening?
So the gold standard is a colonoscopy. That is a procedure where you go to theater, the surgeon or the gastroenterologist inserts a fiber optic scope, which has a camera and a light at the end, and it visualizes the entire colon. So the gold standard is a colonoscopy because it can visualize the entire colon. If there's any suspicious areas, a biopsy can be done to confirm the diagnosis. And if we find a polyp, it can be removed, so it's therapeutic. So that's a gold standard. There are other screening tests that you can do, such as testing your stool to see if there's blood, or the stool for occult blood. You can also go for a CT colonography or a capsule where you can swallow to visualize the colon, but the gold standard is a colonoscopy. And it is recommended from the age of 45, every man and woman should go for a colonoscopy. If you have risk factors such as previous history of colon cancer, history of previous polyps or inflammatory bowel disease, you have to go, or genetic history of colon cancer, you have to go for the colonoscopy a little bit more earlier.
So if you're over 50, you should try and do it. How frequently should you do
45. 45 is the new age. 45.
45 is the new age. Okay, yeah. The age has gone lower. 45. So how frequent should you do it? How often?
So if you do the scope colonoscopy and it is normal, your gastroenterologist or surgeon will say every 5 years. But if they find any abnormalities like abnormal polyps, or if the polyps show a little bit of change of abnormal cells, they might say yearly colonoscopies.
Yeah, my doctor said to me 5 years ago, I need to do it every 5 years. So 2023 is my year. I better make a date with him. But many people will find this uncomfortable. I mean, when we talk about these diseases, like, it's down there. You don't talk about things or down there. But I didn't experience any discomfort at all because I didn't even realize that it had been done. The doctor was quite good.
Yeah, so it's a day procedure. You might have to prep the day before to you get medication to clean out your intestine. You go for the procedure, you're under anesthetic, you don't feel a thing, and you can return to work the next day. So it is a life-saving procedure, and I advise every person out there in the public above the age of 45 to please go for their colonoscopy.
Now, if you've picked up any of the symptoms you've outlined earlier, what would be the first steps to do to prevent it from advancing to higher stages?
So early detection, if you can pick up any cancer early, you can treat it with less intensive therapies and then you can be cured. So if you have any of these symptoms, please go to your doctor. You can go to your GP and the GP can refer you to a specialist where then they'll do the necessary tests to check and see if you have any disease or any cancer.
Yeah, thank you very much for your time this afternoon, Dr. Smitha Abraham, and for explaining some of the key aspects in this Colorectal Cancer Awareness Month being March. Please listen to your gut and take care and watch out for any symptoms. Check out your family's history as well. And if you may, and you're above 50, don't be afraid. Go and do a colonoscopy. I'm due for one this year.